Many of us spend most of our waking hours on the job, so being able to eat well, move more, be tobacco-free, and take charge of our health at work can make a big difference. Whether you own a business, manage a corporation, work in government, or teach our future workforce, creating an effective wellness program takes 4 key steps. Inspiration is essential to any effective program. One of the best ways to inspire your effort is for staff to see leadership that walks the talk by striving for their own wellness goals. Teamwork is another critical element. Engage a wellness team with frontline workers and leadership from across the organization. Together you can gather great ideas, solve problems, and continue to spark your effort. Of course, you'll need to inquire to create the right program and measure its success. What are your employee health issues? How about sick days, healthcare costs, and workers' comp claims? The Wellness at Work assessment will help you consider your work environment. Don't forget to ask employees what they need and what motivates them. Finally, you'll need to act. Use the data you've collected to create a plan. Then dive in, see what works, and celebrate your wins. There are also great examples from workplaces across the state. We visited a few of them and hope these stories will give you some new ideas and inspire you to create a worksite wellness program and a culture of wellness at your worksite.
I think we came to the realization that, we had a legal obligation to provide a safety program, a wellness program. And if you're going to have an effective program, it has to become part of the company culture. You have to live that program, and it has to have active participation from the top down.
We looked at our workers' comp costs, our insurance, and looked at the number of injuries and decided that we needed to do something. And one of the first things was to institute mandatory pre-shift exercises, and we worked with a occupational health nurse and a orthopedic surgeon who actually came out and looked at our place and developed stretching exercises specific for our workforce.
They were used to the angle of the tray, they were used to the position of the paper box, and they didn't want to make any changes. But some of them, we finally persuaded them to try a new way, and they adapted well and found that there was a personal benefit to them. They could pack longer without, incurring any injuries, and that's the bottom line.
Our turnover rate is less than 1%, and that is a savings in itself because you're not having to train employees every year.
I think we saw some returns we didn't anticipate. We knew there was going to be expenditures made on the front end, and I think that's what a lot of companies focus on, and that's really their own focal point. An effective program keeps employees from being injured. An injured employee goes through all that pain and suffering. In the process, you lose the teamwork, you lose their effectiveness. It ends up costing you money in the long run.
The dollar figure is great, it's fun, it's wonderful, it's the bottom line, but the human factor, the payback for the human factor, the loyalty is priceless. You can't put a price on that.
When New Seasons started, I was pregnant with my first daughter, and so that was 12 years ago. I had my first daughter soon after New Seasons opened, and she still likes to be referred as the first New Seasons baby. It was probably around 2004 that we started putting policy into place so that people knew before they left on maternity leave what to expect when they came back. So we have a room that other people can use as well, but a breastfeeding mom that's going to be pumping at work or having their baby brought in has first priority.
There's this room upstairs that no one was really allowed to use for anything because that was Peggy's pumping room. It is, in fact, the pumping room for all of the mothers to use if they so choose, but I was the one that was pregnant at the time and that they knew were going to be using it. So I got my very own room.
Do we all benefit from a healthier staff? Absolutely. No premium increases is a great example of that. We got to add to our benefits this year. We got to do a lot of great things because people are taking care of themselves, and that's, I think, the incentive to do it, or how to explain it, that shows the long-term sustainable effects of a wellness program, is that we get to do more for less money because we're using our dollars wisely, and we're healthy. It's not, you know, it's not completely altruistic because everyone gets a win, but all boats rise with the tide. And so, you know, the healthier we are, the more money that we can spend to do other things to make people healthier, and the more money we save, you know, the more money they save.
Okay, we're a CPA firm, and we have a very busy tax season, we call it. It runs from January 15th to April 15th. And so that's the time when we probably do about 70% of our work. So what was happening every tax season is people feel compelled to come to work when they weren't feeling that great, and we would get a lot of people out sick. Their resistance is down, they're working too much, they weren't eating right. We had what we called the trough in the break room, and we kept it stocked with M&Ms. We even had Twinkies or Ding Dongs or whatever it was that could give you a boost, and it was usually sugar. So we had their firm retreat where we leave the office each year and work on things to improve in the firm. And we decided on a firm retreat that what we were going to work on that year was the employees. How do we improve the employees? Not their performance, but their lives. And so the centerpiece of our program has been the walking challenges. And those walking challenges are where we challenge everyone to walk 10,000 steps a day.
At that point in time, I was kind of unhealthy. I was a smoker and a drinker and was really overweight, and it just kind of sounded like a good way for me to maybe start some changes in my life. As soon as my boss found out that I was going to quit smoking, she immediately jumped in and said, what can we do to help? And they paid for all of my patches, which was a huge expense. We have a lot of input here from the employees of what we'd like to do, what we enjoy doing, what we really didn't care for. We've had a few things that employees have expressed that weren't the most fun, and we've kind of cut those things out because it's really about motivating and having fun and having us enjoy what we're doing and not just doing it because we're told to. So
our first tax season that we did our wellness program, our sick days dropped almost 60%, which is huge.
It's basically changed my life forever. I'm happier, I'm healthier, and I don't think that I would have gotten to this point unless our company started their wellness program. It really gave me the confidence and the kickstart I needed to start a healthy lifestyle, and I'm proud of myself, and I'm proud to be an inspiration, and I hope that everybody else in the office, you know, feels the same way about the wellness program like I do.
Wellness is a lot about education, educating yourself about the importance of exercise and then of course doing it, or the importance of eating well. So as educators we want to model for our students. The school district taking the lead was natural, but of course the other great partner is Willamette Lane, because you know you're in this wonderful center. It's definitely a win-win for both of us, because a lot of people come here and now they're telling their friends about the fact they should come here.
I don't know how many employers offer gym membership for $5 a year, but I couldn't say no. I couldn't pass that up.
People have all kinds of issues, even mental issues, depression. Sometimes you're losing days at work because of different issues like that. And getting into the wellness program makes you more present. You're there, you feel better, and you're going to do a better job.
When we first started looking at a wellness program, we had to figure out how to fund it. We knew it would take more than just staff costs. It probably would take some funding of some sort to get things in place. And then we just started studying various resources that were out on the web. And the one that we found was a grantor, OEA Choice Trust, who would help school districts specifically start programs.
We really encourage the schools to assess their own needs and what their culture is like, because Oregon is very different. And so your school districts are different across Oregon. And so they look at their environment and see what works for them, but we help give them some guidance. You can do a lot of things just with your health carrier. They have smoking cessation programs, they have Weight Watchers at work, they have healthcare coaching. They have a lot of online tools and resources that is at no cost to the member. It's amazing.
Healthier people are people who are better workers because they're in better physical shape, and not only are they getting in better physical shape, but they're improving the culture of the organization they work in. When you offer people options to become healthier, they really believe you care about them. So, you get both benefits. You get the production and you get the human side, which is we care about you. Doesn't get better than that.
When we first began our bike program, which has been probably our most successful program and the one that a lot of employees get super excited about, we were thinking that we hadn't offered anything to our employees for alternative transportation to get to work.
Standing Stone bought us a bike, and I signed up to ride my bike 45 days in 1 year. I made a little deposit on the bike and paid like an income tax on it. And then after I rode my 45 round trips commuting to and from work, I got my deposit back, and then the bike is mine.
One of our employees, who is an actual yoga instructor, approached me, said, Danielle, I think that we're missing something in our program. The bikes are great, but we all work really long hours on our feet. And that's true. No one sits down in the service industry.
So we decided to use this space. In the morning, the floor is cleaned, tables were swept out, and people would just have to come, and the chairs were already in place or moved out of the way. And at the end, we would just put everything back, and it was like we were never here.
We have an in-house graphic designer that whipped up some really cool mats for us, designed for Matt, and we put an incentive to the yoga program. So our incentive was that if you came to 12 yoga programs, then you earned a nice Standing Stone customized mat just for you.
We wanted to do the classes here to make it accessible for the employees. A lot of us on staff here don't have cars, so making it as something as convenient as just getting to work.
So our farm project has been amazing in many ways. When it was blackberry picking time, we took groups and groups and groups of people out there to pick blackberries. Same thing with pear picking time. And then we can bring them back, and that food is what we're serving to our patrons. It came from our land, and it's a really fantastic thing. I think that the biggest bottom line that we have seen over the years with these programs is general employee happiness, which has definitely led to fantastic employee retention.
I definitely love working here, and I plan on only working here for one summer, and now I'm coming up on my 5th summer. So there's a lot of reasons to stay here.
I think I would definitely have moved on. Not that Ashland isn't fantastic, but Standing Stone is my family, and I love it here. Yeah, they've definitely kept me. They've kept me here.
Samaritan has really had a growing culture of wellness over the last few years that I really think began with the tobacco-free campus policy.
We, of course, had been tobacco-free inside our facilities for years and years and years, but had not extended that policy to apply to our grounds, our common space, and even to cars in parking lots. We have chosen to have the no tobacco policy apply in all of those areas. One of the things that we knew that made us feel very comfortable with making this change is that we did do a survey of our employees several months before the policy went into effect. And what we found was that well over 90% were in support of this new policy of going tobacco-free across the campus. That really made us feel good about the decision.
So there was a lot of interest after the tobacco cessation policy took off to do something else. And one of the ideas we had was to develop a program to improve the nutrition in our cafeterias and the choices that employees make when they go to our cafeterias for breakfast, lunch, dinner, or a snack.
The Carrot program at our hospital is a nutrition program in our cafeteria. Individuals who purchase Carrot items in our cafeteria get a 20% discount. And the Carrot items follow some nutrition guidelines to help our customers and employees make healthier choices in our cafeteria. And it's very easy to select the Carrot items because it's on our menu. So it's not, they're not having to read nutrition labels. They're not having to figure out what the guidelines are, what the healthy food is. It's just, here's the Carrot item. If I pick this, then I get a discount.
Sam Fit incorporates two different models, a fitness center model, 24 hours a day, 7-day-a-week access, with a wellness model of health risk assessments, health coaching, and health education.
Now our SamFit model is really probably the optimal approach to trying to influence healthy outcomes, in that now we actually have the location that we can apply the theory to. So we can take the concepts and say, okay, if you actually work out this many times per week, and if you change your lifestyles, what does that really do for you and do for the organization in terms of lowering costs? We pushed aside any kind of membership fee and said, so we had a low cost of entry into it as best we could, and we created some immediate feedback loops to the person that's enrolled here, so they know, how am I doing?
We had various predictions of our membership volume, our engagement, and our success level, and we have surpassed our expectations, our annual expectations, in the first quarter.
Our leadership bought into the concept and practiced it ourselves. So as you got the leaders more engaged in fitness and wellness and working out and nutrition and lifestyle and so forth, it was more transferable to our workforce at large. And then from that, we could see some benefit coming back to us, and again, decided to kind of incrementally continue to invest in it. If we do find ways that can lower healthcare costs through improved health status, population health, if you will, and we can apply those strategies across the continuum, we should see an overall reduction in healthcare costs. So it's a good chance for us to measure, does it really make a difference, or do we just think it makes a difference? But I think we're going to find out it does.
So it starts with that increased morale of the employees, which decreases absenteeism and presenteeism, which then increases productivity and creativity on the part of those employees. They're happier then, and their chances of staying within the company and having lower turnover is really a benefit of that. These are really economic factors that many companies don't take into consideration. Then, as those things are in place, the decrease in healthcare costs will follow.
Now it's your turn to create your own success story. Please join Wellness at Work.